Jeremy Holman is a senior consultant at JSI with over 15 years of HIV experience, including capacity development and technical assistance. He is currently the project director of JSI's HIV Prevention Capacity Building Assistance Project, called CIBA at JSI, funded by CDC, which helps build the capacity of community-based organizations in the U.S. to deliver high-impact HIV prevention services. With more than 13 years of experience working on U.S.-based and international health and education capacity building programs, Saul currently manages the Title X National Training Center for Quality Assurance, Quality Improvement, and Evaluation. This program serves a network of more than 90 federally funded family planning grantees and their service networks. Jeremy and Katie will discuss how policy, programmatic, and technology trends in the U.S. have led to an increased use of technology for capacity development, as well as lessons learned and challenges from taking this approach in their own project work. We would love to hear from you throughout the presentation. The meeting will be muted, but you may use the chat function to submit your questions to the webinar host. Jeremy and Katie will then take your questions at the end. Please also know that this presentation is being recorded and will be emailed to all meeting participants. So welcome again, everyone, and with that, I'm going to turn it over to Jeremy.
Great, thanks, Elizabeth. So for today's webinar, we will describe and discuss a couple of factors that have resulted in a new generation of capacity development in the United States. This new generation of capacity development relies heavily on technology, including web-based distance learning methods for training and skills building. And also during this webinar, we will describe these various methods and some of their benefits and limitations. But a few notes before we continue. Throughout the webinar, we will use the abbreviation CD, which means capacity development. In the United States, we tend to use the phrase capacity building to refer to the same concept. We also use the phrase CD consumer to refer to organizations or individuals that use or consume services to build their capacities. We will also use the term CD provider to refer to organizations like JSI and others, some of you may be on this call, that develop and deliver services and products to build the capacity of other organizations and their staff. So as Elizabeth mentioned earlier, Katie and I both manage large capacity development projects in the U.S., and from our perspective, we've really seen an evolution in the services we provide, particularly over the past decade and even more so over the last 4 to 5 years. Of course, the content has changed in what we've been providing as organizations and as the world has changed, but what we're focusing on here today is more on the way in which we deliver services, a process that's gone from a more traditional approach to a new and quite different model. Traditional capacity development has tended to use staff to provide in-person training or other services, and these services have used technology but not at a very high level. In addition, there's been tended to be a low ratio of capacity development consumers to the providers, meaning one capacity development provider staff was providing services to a small group of staff at an organization. These services usually required a lot more time and travel expense, either to send our staff to organizations to provide the services or to host training or capacity development events to which organizations could send staff. These services also intended to be low flexibility, and by that I mean staff that wanted the services needed to take advantage of them when we were offering them. But over the past decade, we've seen a change in this model. Today we send our capacity development staff to sites a lot less often, and we do so more strategically, meaning only when it's necessary and when it's likely to achieve an important outcome. We've done this by adopting and using technology-based approaches, and we'll describe these in a bit more detail later. These services allow us to serve more consumers, reduce costs for time and travel, and provide a lot more flexibility for consumers and how they access and use capacity development services. So what has facilitated this evolution, and what factors have been at play, and why have we made this transition? Katie and I suggest there are at least 3 major factors, and we'll discuss these in the next few slides. The 3 factors are really rapid improvements in technology, budgetary constraints, and programmatic goals, and I'm going to describe each of these in a bit more detail. Firstly, technology advancements and their adoption have been rapid. In this map, broadband internet availability across the U.S. is quite high. So as you can see here, where we see dark blue, that is where broadband access is in the 90 to 100%. And you can see this is a large part of the United States, and where it's lower, and that's in the yellow and red colors, tend to be where there are fewer people. This chart shows us home broadband versus dial-up access, and as you can see here, over 70% of adults over 18 access the internet using broadband, and this is a rapid increase. And broadband means the capacity to download a large volume of data and information very rapidly. So right around 2004, you can see that broadband began to exceed dial-up. And about 2/3 of cell phone owners go online using their phones. And this is more than double the percentage from just 4 years ago. So what have been the impacts of this? Right now, we can produce high-quality, technology-based capacity development products, and people can use these products from their home or work, and they're able to use them without any interruption and with a large amount of ease. But these changes in technology have really required us to think differently about how we both plan and deliver services. We've had to find new ways to develop and market our services and generate demand from consumers that have very little connection to us, and whose own self-motivation and their own commitment is essential for the success of this new model and the service delivery approach. The reality is that in public health, we never have enough funding to do what we need to do. That's just a given. However, the current fiscal climate in the U.S., both in terms of the Great Recession as well as the dysfunction at the federal level, has further restricted availability of funding for public health and for social services of all kinds. So what we call community-based organizations, or CBOs in the United States, or what are called non-governmental organizations, or NGOs on an international level, really struggle to meet demand for their services. And when faced with fiscal constraints, capacity development and professional development are often the first things to go. And unfortunately, this is often when organizations need it most. In addition, funders increasingly put very tight restrictions on the use of resources for professional development, especially any professional development that would include travel of any kind. And these restrictions, of course, get more stringent in times of fiscal crisis. Similarly, capacity development providers face the same budget constraints, including less ability to use resources for travel, increased expectations that we can do more with the same amount of money or less, and that we can also reach more consumers. And as a consequence, we really need to be able to provide more flexible services. And by this, I mean services that can be accessed at times that are most convenient for staff, meaning they're available on demand, they don't require travel, and they don't require a large commitment of time or a redirection of energy that sort of diverts staff from their organizational mission. Lastly, there have been some programmatic goals that have been factors in this evolution. In the field of HIV in the United States, the National HIV/AIDS Strategy, which was passed in 2010, has set ambitious goals that for reducing new infections and improving access to care and treatment. In addition, the CDC has adopted a high-impact HIV prevention approach, focusing on those activities that are cost-effective, can be scaled up to the larger scale, and most likely to have the greatest impact in averting new infections. In family planning, we're seeing a similar shift. With decreases in federal and state funding and the changing healthcare environment in the United States, family planning clinics have really had to adapt to new systems and new models of care. To survive these changes, they've needed help enrolling uninsured patients in health plans, adopting electronic health records, and partnering or integrating with primary care providers. And these major shifts have really reprioritized the need for timely and widespread technical assistance. So consequently, organizations like JSI that provide capacity development services for these organizations have to support them in achieving these goals. And as a result, we need to provide services that are cost-effective, that have the greatest impact for the greatest number of organizations. So all these factors I've described so far have come together to create a greater demand for and use of technology-based distance learning capacity development services. But this presents some challenges. Overall, these techniques require a new and often specialized set of skills that go beyond content and the ability to train people. And I'm talking about expertise in web-based curriculum, both development and production, the videography, the ability to do animation, sound editing and engineering, and you simply just can't take someone who can do an in-person training and expect them to be able to do online or distance learning methods. And given the number of options for how to use technology, there's a real need to balance and understand the advantages and disadvantages of all the different methods that are possible. So I'm going to turn this over to Katie Saul, who's going to talk a little about these options, their benefits, and their limitations.
Great. Thanks, Jeremy. So I'm going to highlight some of the methods that we use most commonly on our U.S.-based projects. And it's a little difficult to compare them by any one quality or characteristic, since they can be used in a variety of contexts and with varying sophistication. But since participation is one of the hallmarks of JSI's CD work, we're going to look at them today according to their level of consumer engagement. And I'll just reiterate that by consumer, we're referring to our audience. So as you can see on this slide, the continuum isn't very linear, and this is because of the many ways that each of these methods are used. Many of them are complementary, and we often combine two or more methods to engage our audiences. And finally, the range of options these days can also be a little daunting. So choosing the most appropriate method or methods often depends on your objectives, your audience, and a number of other contextual factors. So social media, for example, is a great way to reach large audiences and raise awareness. But it's quite limited in the extent to which it facilitates skills building or changes in practice. So we often use social media to disseminate information, to hook our audience, and as Jeremy said earlier, we use it to market services and to generate demand, especially from those consumers who may otherwise have very little connection to us. And this is one of the challenges I think that often gets most ignored. Unless you're working with a known audience or cohort, attracting participation, especially from a large national audience, can be one of the biggest hurdles. JSI's AIDS.gov project has really successfully used social media to raise awareness about HIV and AIDS in the U.S. Its blog, Facebook page, and tweets have enormous reach, and they're effective ways to see what HIV-related issues are trending and to see what's on people's minds. Webinars have become ubiquitous in the past few years, and we've learned a few lessons from using them as well. They can range from didactic presentations with large audiences to small virtual meetings with participants who are actively engaged through chat, polling, hand raising, and whiteboards. But using webinars to their full potential really requires skilled and experienced facilitators or hosts. And it's important to note that while capacity development providers have become really savvy in their use of webinars, many of our consumers haven't. And so it's really important to manage your expectations of your audience. Communities of practice are another online networking space, generally in the form of a website that's either open to the public or secured with a login for limited or monitored participation. There's quite a range of reach. There's quite a range in their reach and sophistication, although characteristically they have discussion boards on specific topics or challenges. They're moderated by experts, and they usually also have a place to upload and share resources. And as we noted, these days we're more disconnected from our consumers, but they're also really disconnected from each other. And so we've been using communities of practice to facilitate peer support and to connect consumers who have shared interests and objectives. Communities of practice also work particularly well when they're combined with other methods, such as webinars or online classes. So for example, webinar participants can be directed to a community of practice for an extended online Q&A or to share resources relevant to the webinar theme. One of the challenges with communities of practice, however, is that uptake can be fairly limited without a captive audience, much like social media. So you need to maintain consumer engagement. And online modules are a method in which we've seen a lot of growth at JSI over the past few years. And they're not cheap, especially to produce a narrated, animated course, but their potential to reach a large audience over a long period of time usually outweighs the upfront cost. Online modules are convenient for the consumer, and they allow us to delve a little deeper into technical content and skills. However, we rely on highly motivated and interested consumers to engage in online modules. So again, knowing your audiences and your audience's needs is essential in deciding whether to design a short targeted module or an online course. And depending on how the online course is structured, consumers can either take an entire course or just a few modules within the course that suit their needs. Online courses can also be recycled for different audiences. So for example, Data Academy was designed for HIV service providers, but in my work in family planning, I've often referred providers to various modules in this course. And then online institutes differ from online modules in that you have a more captive audience or cohort. Online institutes or classes run several weeks. Participants engage directly with the moderator or facilitators. They're also an example of blended distance learning, so they often combine webinars, videos, communities of practice, online modules, and often follow a class syllabus. And then finally, learning collaboratives are another example of blended distance learning. So for example, we're working with a cohort of 10 family planning clinics on a learning collaborative to improve clinic efficiency. They initially met face-to-face, and now they participate in monthly webinars, implement improvement plans, and they input data into a shared online system. And it's similar to an online institute, but in this case, we focus on peer learning, devoting most of the monthly webinar to facilitated discussion among the participants. So clearly, technology has created many new roads for capacity development. Compared to traditional on-site, face-to-face technical assistance, distance learning has helped us reach larger audiences around the world, much more frequently and at a lower cost. Online spaces allow our consumers to connect with one another, and they provide more efficient ways to share existing resources and capitalize on their experiences. Online products can be reused and recycled for different audiences over time, and they attract really highly motivated learners who are committed to applying their skills and improving the quality of their services. But there are also a few limitations, and while we've become very adept at engaging our audiences online, technology and on-distance learning may never really equal the quality of face-to-face interaction. And so the more people we reach, the less likely our efforts will be tailored to their specific needs. So does this mean that we're ineffective? Well, not necessarily, but it depends on what your objectives are. And unless you have a known captive audience, it is really difficult to measure the full impact of our capacity development efforts. And another limitation is cost. And cost varies, and time and effort also shouldn't be ignored, especially for the consumer who has to commit to applying what they learned. And as Jeremy said earlier, these methods tend to attract really highly motivated and invested learners. And we sometimes only reach the quote-unquote A students who have interest and motivation to engage. And then finally, the technology. For all of its benefits, it does sometimes get in the way, either due to logistical issues like bandwidth or access to computers. But it's a balance, and we're learning how to use technology a little bit more appropriately and in new formats, like on mobile devices. But there's no doubt that our clients and consumers benefit from the convenience and the lower cost.
So in conclusion, given some of the limitations of the technology, nonetheless, sometimes face-to-face interaction is still needed, but the reality is we're not going back. Technology is here to stay, and technology's role in capacity development is here. And there's really strong evidence that distance learning can work. Universities have very quickly adopted these approaches to online learning, and so have capacity development providers. They are cost efficient and they are effective, we think. But we really need to, as technology improves, our approaches are rapidly evolving, and we really, you need to decide, and we have to work very hard to decide which technology is most appropriate and for what it is we're trying to achieve. And it may be, as Katie mentioned, a blend of some of the different methods. But provider training is really essential. You need to, providers will need to train staff on a wide range of skills and techniques. You simply, as we said earlier, can't take a great in-person trainer and trust they can do web-based training. And finally, there is really the challenge is understanding and maximizing effectiveness, which will really require us to do more robust evaluation of these mechanisms and their impact on capacity. While there's been a really rapid movement toward online and distance learning methods, we're still learning about how to use them most effectively. In fact, just yesterday, in yesterday's New York Times, there was an article that highlighted some of the challenges of fully online learning, and some of the big challenges are primarily attrition, meaning if you're not seeing the person in face-to-face, they may enroll in the course, but by the time you get to the end of the course, they've disappeared. And so we've seen similar issues with some of the work that we've done, particularly the longer online courses like the institutes, that really suggest that a blended method is more appropriate. That includes both in-person and online activities that come together to create a really effective package of capacity development services. So with that, I will end there and turn it over to Elizabeth for questions.
Thank you, Jeremy and Katie. Again, if anyone on the webinar has any questions, please chat your questions to the host, the webinar host, using the chat function, and I will pose those to Katie and Jeremy. So just to get started, a couple questions here. As Katie mentioned, it seems that there's a bit of education that needs to happen for new participants who are not accustomed to online learning. So what have you done to educate or acclimate your participants, potentially for your online institutes or your modules, to this new method of learning?
Well, I can speak at least to webinars. I think it really varies depending on the type of method you're using. For webinars, we've grown really accustomed to using, the first couple of minutes while people are logging on, or even the first slide of the webinar to point out where the chat function is, where the hand-raising function is, and get people comfortable with using it. We also sort of set the tone for participant engagement. Often we'll throw out a quick question in the beginning, depending on the size of the audience. If it's 20 people, we'll say, what's the weather like where you are? Or, if it's a known audience, what did you do for the holiday? Or, just a kind of a chatty question just to get people engaged and talking. But it really is important to show folks where those functions are in the beginning, because a lot of people don't know. And then I think just for longer term engagements, making sure people understand the commitment that's involved, both time-wise, but also with regard to the technology. Just being very clear that we expect you to log in for these monthly sessions, to engage, we'll be calling on you, please chat, and just being really clear what you expect of folks at the outset.
For the institute that we did, that was a 3-week course that people signed up for, we actually built in a 4th week, which was the first week where we expected students or the participants to log in, create their profile, and we had a set of activities for them that really weren't related to the capacity development, but were ways for them to get used to the technology. So posting a profile, participating in a discussion board, and they could do this in a way that was safe and gave them some time to get used to it without feeling like it was cutting into their capacity development, the training that they were getting. And, I think we had roughly 30 to 35 participants for each of those institutes with 3 facilitators. And so each facilitator was given a cohort of 10 participants that were theirs, that they were monitoring whether they logged in, sending them an email if they seemed to be having trouble, or even calling them if they needed help to walk them through. And again, that points to the fact we can't do this without people. So that even with an online institute where people were going to be engaging remotely through a distance learning, we still needed humans on the other end of the phone when someone needed help.
And I would just follow up that in our evaluations, too, we gauge participants' comfort with the technology. So oftentimes we'll put in a question that says, how comfortable were you with the technology used today, with the level of engagement, and, a few other questions just to gauge how people are feeling.
So you guys discussed that evaluation is still a challenge, and so I, not to put you on the spot, but how do you know, if your webinars are successful? We're talking about webinars, but also some of your other online training methods.
Well, again, I think it varies by method, and it depends on what you're interested in evaluating and maybe what you are us as providers are being evaluated on by our funders as well. So is it the number of people you've reached? Is it the level of engagement, the number of people who have clicked or participated or chatted in? I think, as we mentioned during the webinar, what gets trickier is knowing the the longer term, medium to longer term outcomes of capacity development. You know, I think capacity development in and of itself is a longer term initiative, and it's really tricky. One of the things that we've tried to do is, you know, 3 months to 6 month follow-ups with folks who have participated in our events, whether it's a webinar or a longer term initiative, just to see what skills they've applied, if at all, what's been most challenging since since they had to go back and apply some of this in their work, and just trying to gauge how and if people are using what they learned.
It's a really hard thing, because I think even in the traditional model, trying to measure the impact on capacity was really difficult, and I'm not sure we were that good at doing it even then. And, you know, even in that case, that's, let's say, a group of consultants were to spend months with an organization, in person, doing really in-depth technical consultation, we could perhaps evaluate what that's done in terms of their organizational capacity. Now we're doing, you know, many webinars and online trainings that may be an hour out of a person's life who works for that organization, and it's really hard to measure how that one specific 1 hour engagement may have produced longer-term capacity improvements for that organization. That's a big, big challenge.
And I think just to repeat what Jeremy said earlier, and referring back to this New York Times article, and I would encourage those of you who are online with us today to have a look at it. One of the phrases that stuck out to me in the article was, iteration is key to innovation. And I think we're really trying to figure this out as we go, and I think everyone in the field is. In the Learning Collaborative that I was referring to a few slides ago, now that we're about 6 months in, we're kind of sensing that people are feeling a little tired with the process. And so on our evaluation after yesterday's session, we said, you know, we're sensing a little bit of Learning Collaborative burnout. What's going on, and how are you feeling? And just trying to gauge and learn from our participants as much as we can, so that the next time around, you know, we can try things a little differently. But it's tricky.
Well, let's jump from evaluation back to some more of the process for developing these materials. So from a practitioner perspective, how does creating an online course compare to developing in-person trainings? What's different?
You take that one? Well, you know, trainers will develop an outline and they've got content expertise. And, you know, the method of engagement is, you know, pretty clear when you're doing an in-person training. Web-based development really requires that everything be thought out, planned, scripted, and storyboarded, quote unquote, in advance, which is a lot of advanced work. But not just that, it is what is it we're trying to communicate, and what's the best method? Is it a video? Is it animation with a voiceover? Is it just a PowerPoint? Is it a webinar? Is it you know, a longer-term course that combines all of those things? So there's really a very thoughtful process that I don't think we went through so much with a training. I'm going to go do a training. You might think of some hands-on activities within that training that help make certain points come to life. But I think there's a lot of, for the web-based stuff, a lot of upfront planning that needs to happen before production, because production is intricate, complicated, complex, and expensive. So you've got to make sure everything is the way you want it before you head into that process. And then testing it and working out the bugs and seeing how people consume it.
I think something else that we've learned is that it requires a whole different range of skills and expertise. And so with face-to-face, you had someone who was an experienced, you know, either experienced in that technical area or in capacity development, a trainer, whereas now you need those skills and expertise plus the web folks or the design folks. So Elizabeth, who introduced our webinar today, we work with really closely to design the online format. And as Jeremy said, that's a huge component because that is how people are engaging. So while the adult learning and, you know, objectives, development, and all of those elements are still key, that interface is almost even more important because that's where people are engaging.
Yeah, another thing just to add about, you know, the difference between training that we've experienced, online training versus in-person training, is you actually need a little bit of a larger team, whereas with the in-person training you can you can just have two trainers who go off and develop the outline and develop the delivery. With the online modules specifically, you do need you need your subject matter experts. You potentially might need an instructional designer who's really well-versed at taking that content and figuring out how to best deliver it online. You're going to need a graphic designer, and then you're going to need someone who can actually develop and build a course. And that's sort of, and sometimes that requires some multimedia, some animation, or some video recording. So that's where, when Jeremy mentioned the cost of these things, you do end up, when you do invest those resources, you end up with a really rich product, but it does take a larger team. So one question I wanted to add for you guys again is, are there sorts of types of training or skills that are more or less appropriate for online delivery, that just, hard skills, soft skills, how do those things compare? If you were going to make any recommendations for in your experience, is there information that's been easier to adapt for an online training versus more difficult?
For our capacity building assistance project, what I think led us to pick what we were going to create for online trainings was we were getting multiple requests for technical assistance around a particular topic. And so we would send staff out to the organization, and we would find that there was a unequal or disparate level of knowledge within the staff that we were being asked to train or to work with. And so what we ended up doing was figuring out what could we create that would create a baseline for the organization so that everyone there could take that course and be up to speed, and we would know what their baseline knowledge was, and then we could then complement that with other content or other technical consultation. Not helping in terms of the content, because I think it's really on a case-by-case basis. What is it that's something that people can learn? I think we know this a little bit innately. We know that there's certain things that you need to be communicating. You need the eye contact from someone to be able to communicate and work through problems, and there are still things that are going to require people sitting down in a room for a couple of hours and working out. But there's information, content, knowledge-based stuff that I think really translates well to an online learning.
Well, a lot of times I think when we'll go out and look for great examples of e-learning, how are others doing this really well? And I do find that a lot of the examples are very hard skills. So talking through a process or how to build something, or when you have a customer experience kind of, step by step, we see that a lot in the private sector. And I think what's can be challenging about the capacity development work is when you're focusing a little bit on what we call the soft skills, you do have to be more considerate of that type of information when you're developing your online delivery than you might have to for an in-person training. So it's just something to be aware of. While we're talking about your work, we'd love to hear about the types of online courses that you all have developed for your projects and what you're planning to do in the future.
Yeah, want me to go first? Katie's looking at me, so I'll go first. We've developed, for the Capacity Building Assistance Project, we have, make sure I can remember all of them, but we have one on how to use social media for HIV prevention, and that's available as an introductory course because we were getting a lot of requests for assistance, and so we wanted to make sure everyone kind of had the basics. And I think that's available in both English and Spanish. We have an introduction to monitoring and evaluation focused really on HIV prevention, also an introductory course, and that's available in both English and Spanish. For the using social media, we now have a primer that goes along with that, which is a kind of a follow-up that's really about how do organizations create social media policies for their organizations. What are the guidelines and parameters within which staff can use and can't use social media for the work that they do? And I think we've got another one coming on social networking strategies and how to use those methods for engaging people in high-risk communities for HIV. Did I capture them all?
And one more, we're also working on a social media monitoring and evaluation course.
And for family planning, we've developed an online course on the adolescent brain and changes in the adolescent brain for family planning providers who do a lot of work with adolescents, why adolescents make decisions the way they do, and just trying to figure them out, which is a huge challenge for our providers. Currently, I mentioned the learning collaborative that we're working on, and we're thinking about turning some of that content into an online course so that we get a larger reach nationally. We've developed a course on gonorrhea and chlamydia, which I actually showed during our slides as well. But what we're trying to figure out right now is really just how to take the content that we have from either webinars or, as I said, the learning collaboratives, and recycling them or repackaging them into different types of delivery packages.
We have another CDC-funded project at JSI that is working to develop what CDC calls prevention with positives, but it's really about how can we train clinicians to implement, or community-based organization staff to implement strategies for improving medication adherence. And the goal of that, because it's under prevention, is if we can get people to remain in care and remain on treatment, they'll become less infectious and their viral loads will decrease. And that is really a new one, because some of that is some of what Elizabeth was mentioning. Our approach on that is different. Well, it's a little bit different in terms of the online learning, because there are some soft skills there about interviewing and communicating with clients. And so these use a lot more video to kind of show how you would do it, and so that people can see different roles and at least witness and practice some of that. So those will be coming out very soon.
Yeah, actually, I was going to say exactly the same thing, Jeremy, which is that video has really helped us to target those soft skills. It's really difficult to do a webinar on effective motivational interviewing, for example, or counseling clients. And we've done three videos in the recent past, one on delivering HIV test results that we've found very useful among both family planning and HIV providers. And then we've also put together two recent videos around improving patient experience. One on why patient experience is so important, especially for family planning providers in the changing healthcare environment. And then the other is demonstrating those soft skills, so ways to improve your patient interactions. And those are both out and online.
So given the proliferation of these technology-based approaches, how do you envision your role as a capacity development provider in, say, 5 years? Where you kind of, you don't have to have a, we're not going to check you again in 5 years to see if you have the right, but how do you see your work changing?
I don't know how much more it's going to change. I think we've made the change. Now it's figuring out and improving what we've put in place and what we've been trying out. And I think given some of the investment in the products that we produce, I think we need to think really strategically about what has the longest shelf life to the extent that we can. Creating an online module, that only has a year shelf life might not be the best investment of time and money. So I think we're going to have to think really strategically about that. I hope that we're able to spread some of the skills so that I don't think it's okay anymore to say you don't know how to do certain things when it comes to technology. I can't imagine someone saying, I don't understand how to use the phone. So we need to get to that point with some of the technology we use with more of our staff so that we don't have to specialize quite so much.
I would agree. Just looking at the online courses that we've developed over the last 5 years and how much the quality's improved, both because our technical skills have improved, but because the technology is that much better. So I think we will find more interesting and engaging ways to develop those. But I also think, as Jeremy said, I don't see it sort of catapulting into the future. I think we've gotten to a point where now we're taking a step back and figuring out what's most appropriate and blending methods a lot more. I think when we first started going online, it was all online. Everyone just went kind of gung-ho with webinars, online courses, and then realized, wait, maybe this isn't the best way to do this, or there might be a few different methods that would work better. So not leaving the face-to-face behind completely, but just figuring out how to integrate technology and use it as a tool, not just a complete replacement.
And that's exactly what this article that's still showing there is what's been found. I think universities hopped on this very quickly because it's cost effective. You can get more people in who are, tuition paying students, and you have one professor or one facilitator with an online course that can teach a lot more students. And the results have been not super. And so I think they're stepping back to say, the future of an all online university may not be as rosy as we first thought.
Mm-hmm.
So thank you guys for that insight. So I think you mentioned some of the limitations. I think as we're going forward, we know there's a lot of folks that are joining the webinar that are international, and we know that network connectivity, we talked about the U.S. broadband, but internationally network connectivity may be an issue. Someone from the chat mentioned that. And also, that, in the next 5 years, as mobile broadband actually is there's more proliferation there, we're probably going to see a lot more mobile learning, especially international, where there's been more work with mobile health. So we're going to have that be our last question today. Thank you guys so much for sharing your insights from your project work with us today. And for everyone on the phone, thank you for joining us. This is our last in the series of 3 webinars, and we're going to, directly after the webinar closes, there's going to be an evaluation. We'd really appreciate if you could complete that to help us for our future webinars, to hear from you about what you'd like to see and hear from us. And also, you're going to be receiving a link to the webinar archive if you'd like to listen to the webinar again later. So thank you, everyone, and have a great rest of your day.